And welcome to this introductory presentation about MO1014 Community-Based Cancer Care. This module builds your rural generalist knowledge and skills in service provision for consumers experiencing cancer who are living in rural and remote communities. You will explore the presentation and impact of the condition with specific attention to the development of clinical practices and service processes. The intended learning outcomes for this module are that you'll be able to examine the broad impact of cancer and its treatment upon consumers within the context of rural and remote health service delivery, and design and develop evidence-based strategies and service improvement options to support consumers living with cancer in rural and remote communities as they deal with issues relating to survivorship and/or disease progression. This module goes for 6 weeks with 22 hours expected workload. You can see the weekly topics here. In Week 1, Introduction to Cancer and Cancer Care, you will review the requirements of Assessment Item 1 before choosing an appropriate consumer and obtaining their informed consent to partake in the activity. You will then explore cancer incidence and the prevalence in general for the specific cancer type experienced by your chosen consumer and for specific populations including rural and remote areas. You will gain a brief overview of cancer biology, symptoms, diagnosis and staging before familiarising yourself with optimal care pathways and how these are represented in your local context. In Week 2, Principles of Cancer Management, you will learn about a variety of approaches used in the treatment and management of cancer. You'll explore the breadth of supportive care services experienced by those living with and beyond cancer before taking a closer look at the impact of your chosen consumer's specific cancer type and one treatment they've experienced or were likely to have experienced. You'll complete a cancer symptom or treatment impact management resource based upon this before submitting the resource and the first 2 weeks of your module workbook by the due date to receive feedback on your learning so far. In Week 3, Principles of Cancer Management Continued, you'll take a closer look at distress, its correlation with unmet needs and the unmet needs of people living with long-term and late effects of cancer in particular. You'll also learn about supportive care frameworks and models that serve to meet these needs. Loss and grief will be explored, along with ways in which health professionals can provide emotional support to people living with or beyond cancer. In Week 4, Communication in Cancer Care, you'll prepare for your upcoming interview by creating an interview guide. You'll explore communication strategies for speaking with people living with or beyond cancer, focusing on responding to emotions and the impact demographic and cultural influences can have on communication. You'll establish a broad question list to be used in your semi-structured interview and consider potential issues that could arise and how you might respond to them. You'll meet with your supervisor to discuss your interview guide before finally interviewing your chosen consumer. In Week 5, Managing Impact of Cancer and Cancer Treatment, you will investigate one issue, symptom, long-term or late effect of cancer identified by your chosen consumer during your interview and relevant to your professional role and local health service setting. You'll examine and summarise specific approaches to the assessment, intervention and evaluation of this issue. You'll explore current ideas related to the use of complementary and alternative medicines and the impact of service provision on a consumer's experience. In Week 6, Lived Experience of Cancer, you'll analyse your chosen consumer's interview by determining the strengths and limitations they encountered during their experience. You'll then synthesise your learning through devising strategies to improve service and specific actions you can take to implement these. Finally, you'll submit Assessment Task 1. A single assessment task is due at the end of the module in Week 6. This task consists of an oral interview with your chosen consumer or one of their family members or significant others, and a written case study analysis of their experience. You will also have the opportunity to submit a formative piece of work at the end of Week 2. This is your module workbook, which contains a cancer symptom or treatment impact management resource you'll develop. This will demonstrate your knowledge of the impact of cancer and cancer treatment on consumers and the various professional roles in managing this. It is not marked, but will give you some feedback on how you are going. We've built in some opportunities for you to interact with the content, the module coordinator and other participants who are taking the module at the same time. There are learning activities which include contributing to online discussions. This provides a chance and an expectation for you to swap professional insights with others who may be from the same or other health professions. This mutual exchange of knowledge is the basis of successful collaborative team practice, so we hope you'll join in. You'll find the module outline in the Start Here folder. It contains your module coordinator's contact information, all the details of the assessment task and marking criteria, information about applying for extensions, any module prerequisites, and the module calendar. Please don't hesitate to get in touch for any questions or concerns, and enjoy the module.